Howdy folks, this is John Adams, the Rehab Documentation Guru, and in case you're thinking I'm really short right now, I'm sitting on the floor of the kitchen in our apartment in Kiev, Ukraine, where we are still in the midst of our adoption process, and it's really late at night here, and I'm trying to project my voice away from the bedrooms so that I don't wake two of my sleeping daughters that are here. And anyway, today I just want to talk to you a little bit about instances where you should not probably be seeing a patient. And I'm going to relate this to, again, something that I touched base on in my last video, which was a slew of denials that we're getting in the area of psychiatric patients. For example, I saw a therapist document just today as I was reviewing claims something to the effect that the patient was depressed, had refused care, and was not wanting to participate in therapy because of that. But they had the ability, functionally, to do those things. They just decided they weren't going to do it. So in that case, you got to ask yourself, am I really going to be effective in this case? Because this is going outside the scope of, especially PT and speech. OT, I know, gets involved in psychiatric care and helping the patient get back to doing activities of daily living, finding purpose and meaning in their activities. So I understand that, but I'm just telling you where Medicare denials are at right now. And right now we're seeing a whole slew of them in that particular area. The other thing I would point out is related to a claim I looked at for speech therapy, where the speech therapist was documenting that the patient had a number of communication disorders, fast rate of speaking, not articulating their words well, having insufficient volume with their voice, mumbling, stuttering with some words. And the therapist chalked it up to the patient's psychiatric disorder or disorder of schizophrenia, and said in the note that these problems were consistent with schizophrenia. So at that point, the question is, well, will speech therapy really do anything for this patient? The therapist basically made it appear, by the way they documented, that the only thing that would help this patient was not speech therapy, but the proper treatment of the patient's schizophrenia, if it could be resolved at all. And so in those cases, the therapist has to ask themselves, should I still be in treating this patient? And more, especially if you're in the SNF setting, although I know this probably trickles into home health even, you're getting more and more psychiatric patients. You're not getting the total hips, total knees, CVAs, hip fractures, things like that, as much as you used to. We're seeing volumes of those diagnoses going down, and they're shifting more towards home health, and if they're high enough level, outpatient. And so, especially in the SNF setting, we're seeing a higher concentration of psychiatric patients that are getting therapy. And unfortunately, in some of those cases, not all, but some of them, the main limiting factor, the underlying impairment that's causing the patient to not function in communication, mobility, ADLs, has nothing to do with something that you treat. And so in these cases, you really do need to think about the fact that maybe you should be training somebody who's non-licensed to do maybe some exercises with the patient or activities with the patient so they don't decline truly in that functional area, and then leave it at that, discharge and get out. Because as you found out in my course, without those underlying impairments, strength, balance, coordination, range of motion, flexibility, endurance, attention, distractibility, things like that, without those measurements of things that we truly treat, there's nothing that we should be doing. We're out of our scope of practice at that point, and so it's time to basically discharge the patient. So anyway, just a little bit of tidbit, and again, this is related to a current issue related to denials. A lot of denials are coming through for generally high functioning, but psychiatric patients whose main limiting factors have nothing to do with the things that PT, OT, or speech treat. Anyway, I hope you found this helpful. Again, I would urge you, I get enough views on these videos that if I could get even just a few comments, I would be psyched. Because I'd like you to bring up some topics you would like to see covered, because all I know is the stuff that I look at day in and day out, and denial trends that we're getting from Medicare and things like that. But you might have a question that'll open up a whole new video or multiple videos that would be helpful to other therapists like you. Anyway, this is John Adamson, the Rehab Documentation Guru, again coming to you from Kyiv, Ukraine, the capital of Ukraine. And I just want to say thank you, and God bless, and make sure you get paid for what you do. Take care.